I have seen quite a number of women approach me to ask, what causes heavy menstrual bleeding? Why is my period flow always very heavy? There are quite a number of reasons for a woman to experience heavy menstrual bleeding. If you want to get those reasons, which we'll be explaining in this video, ensure you watch this video to the end. Hello everyone, welcome to this edition on Body Gist. In this edition, we'll look at what causes heavy menstrual bleeding, how a woman can live a productive life within her menstrual cycle even with the heavy bleeding, and what a woman needs to know about her heavy menstrual bleeding. I am Sister Ozo Augusta, a sister of St. Louis. I'm a nurse, I'm a midwife. Please ensure that you stay subscribed to our channel. Click on the subscribe button. This is me saying thank you to all our returning subscribers. You can do well to also follow us on all our other platforms. We're on Twitter, Instagram, and Facebook. Do not go away. We'll be right back. Welcome back. The causes of heavy menstrual bleeding during a woman's menstrual cycle are limited. If a woman experiences a heavy flow when she is menstruating, when she's on her period, this is known as menorrhagia. Menorrhagia, the spelling is on the screen. So a woman who is experiencing a heavy flow when she's menstruating is said to have menorrhagia. But within the menstrual cycle, if a woman is experiencing a heavy bleeding when she's not menstruating, that is, she's experiencing bleeding during menstruation and outside menstruation, it is known as metrorrhagia. Like I said before, the spelling is also on the screen. Metrorrhagia is spelled on the screen and menorrhagia too is on the screen. Whether a woman experiences menorrhagia or metrorrhagia, the causes are quite many. So we'll try to explain some of the causes during this video. The first cause is hormonal imbalance. For a woman to even engage in menstrual cycle is thought to be the function of several hormones in the body, which you have the follicle stimulating hormone, the luteinizing hormone, estrogen hormone, and progesterone hormone. The follicle stimulating hormone is responsible in stimulation of the follicles. And what are the follicles? These are the ova or egg that is released during ovulation. So the function of the follicle stimulating hormone is to make these eggs or the ovary ready to produce an egg. So it makes the egg to be ready for maturation. Luteinizing hormone is the one that causes ovulation, that is the release of this egg at ovulation. Then progesterone ensures that the uterine lining gets ready to receive a fertilized egg, and estrogen helps in the building of the lining of the uterus. So all these hormones make the uterus ready for menstruation, either receiving a fertilized egg or shedding away when the egg is not fertilized. So an imbalance between the hormone estrogen and progesterone, that is, if there's an imbalance, the hormone estrogen can make the uterus to build up so much that if the egg is not fertilized at the end of the cycle, the uterine lining is shed out. And once the uterine lining is shed, this is menstruation, and because it has built up so much, so the amount of building up will also result to the amount of shedding a woman will experience. So this might make a woman experience a heavy menstrual flow. So an imbalance between the hormone estrogen and progesterone causing a heavy build-up of the uterine lining can make a woman experience a heavy bleeding. So hormonal imbalance is one of the causes of a heavy menstrual flow in a woman. Another cause of a heavy bleeding during menstruation can be women who use certain birth control pills. These pills predispose the woman to heavy bleeding. Then women who also have intrauterine device as a form of contraceptive are also predisposed to heavy bleeding. This is because of the action of these devices and the pills, because of the action of the hormones that they are made with. So it can predispose or cause a woman to experience heavy bleeding during her menstruation. Abortions and miscarriage can also make a woman to bleed heavily during her menstruation. Abortion is the termination of a pregnancy before the age of viability. This can cause a woman to bleed. She can experience severe bleeding during her menstruation. And if an abortion has occurred and a woman is not able to expel completely the product of conception, it can also cause heavy bleeding during her menstruation. So this can be said that if a woman has a retained product of conception, it can lead a woman to bleed heavily during her menstruation, and it can also cause bleeding outside the woman's menstruation, which is known as metrorrhagia. Another cause a woman may be experiencing a heavy bleeding during her menstruation is due to infection, sexually transmitted infection, pelvic inflammatory diseases, and endometriosis can predispose a woman to heavy bleeding. Endometriosis is a condition whereby the tissues of the uterus are detached from the uterus and they are growing outside the uterus. This is a form of infection, and it can make a woman to bleed very heavily. Then another cause is uterine mass. Uterine mass such as fibroids. This mass, which is not benign, that is means it's not cancerous, can make a woman to bleed heavily during her menstruation. Even sometimes some uterine masses can be cancerous. They can also predispose a woman to heavy bleeding during her menstruation. So infection, uterine masses, all this can make a woman to bleed heavily during her menstruation. Another reason why a woman might be experiencing a heavy bleeding might be complications of pregnancy, such as ectopic pregnancy. Ectopic pregnancy is a condition whereby there is fertilization and implantation of the fertilized ovum outside the uterus. It can be either in the tube, which is in the fallopian tube, or outside in the abdominal cavity, whichever one. Sometimes this pregnancy, which is ectopic, can rupture and cause a woman to bleed severely, and these conditions are life-threatening and they need immediate attention. What do we refer to as heavy menstrual bleeding? When a woman is having a menstrual flow and the consistency of her bleeding is frequent, that she changes her menstrual hygiene products such as her pad, her tampon, even menstrual disc or menstrual cups, she changes it frequently as at 2 hours intervals, because this menstrual hygiene product is thought to stay longer. Pads are meant to stay up to 6 hours. Tampons are meant to stay as long as 8 hours. The menstrual cup and menstrual discs can stay at least 10 hours. But if she has to do the changing at intervals of 2 hours, it means that her bleeding is heavy. Then she should seek medical advice. Then if a woman is having a flow that has lasted for more than 7 days in a row, remember that the average length of a woman's cycle when she's having a menstrual flow it should be between 2 to 5 days. She can experience it between 2 to 3 days, 2 to 4 days, 2 to 5 days, or even at most 2 to 7 days. But if it is more than 7 days in a row, then such a woman is having a heavy menstrual bleeding. Then if this menstrual bleeding is also accompanied with blood clots, then slight or severe lower abdominal pain, all this is categorized as heavy menstrual bleeding, and she should seek medical advice, because the result of this heavy menstrual bleeding can be very severe and it can be life-threatening for such a woman. We have looked at the causes of heavy menstrual bleeding. We said hormonal imbalance, and imbalance between the hormones that helps in maintaining the menstrual cycle. Imbalance between estrogen and progesterone can predispose a woman to heavy bleeding. Then complications of pregnancy, such as ectopic pregnancy. If the ectopic pregnancy is slowly leaking or it has ruptured, it can predispose a woman to heavy bleeding. Then the use of certain drugs and contraceptive pills can make a woman have heavy bleeding. Then intrauterine device too that is used as a form of contraception can predispose a woman to heavy bleeding. Infections, STI, pelvic inflammatory diseases, then uterine masses such as fibroids can make a woman have a heavy bleeding. What should you do if you have a heavy bleeding? First is to know the cause, and in knowing the cause, please visit your physician, whereby adequate and appropriate tests will be carried out to help you determine the cause of your bleeding and provide the right solution. Secondly, always take nourishing diets. We have been taught to take our diet as our drugs. So when you take nourishing diet, it will help to replace the lost nutrients that we lose during our heavy bleeding. Then as a woman, you need to maintain a good personal hygiene. If you know you have a heavy bleeding, it means that whatever menstrual hygiene product you use, you should be ready to change it at intervals. If you are using a menstrual pad, you should be able to change it at intervals. If you are using a tampon, you should change it at intervals. If you are using a menstrual cup or menstrual disc, you should also change it at intervals. In managing your menorrhagia or metrorrhagia, you need to know the cause, visit your physician, take nourishing diets, and maintain a personal hygiene. If you have benefited from this video, do not forget to give us a thumbs up. Drop your comments, your questions. We'll be there to attend to it. Thanks for watching this video to the end. Thanks for always following us on Body Gist. And thanks for sharing our videos. Please, you can as well share this video with your loved ones. I remain your nurse midwife, Sister Ozo Augusta. Keep following us on Body Gist while we keep giving you healthy gist.